Theresa Peter, like many members of the Junta Adamu community in Jos, rely on this stream for their water needs. There are sewage systems around it, making them vulnerable to cholera. But she says it's their only water source, especially during the dry season when the rains are gone.
I know that contaminated water predisposes people to cholera, but what do? There's nowhere else to source for water. What is available is what we will use.
Health practitioners say 28 people lost their lives from more than 950 cases of the disease which were recorded in the state last year. Nigeria's Center for Disease Control, NCDC, says the country recorded 4,153 new suspected cases of cholera infections in September and 80 suspected deaths across 9 states of the Federation. Borno State, in the country's northern region, the epicenter of an insurgency in the country, is among the worst affected with 93 deaths from 3,663 suspected cases in the state from January to September. Next to it are states like Yobe with 1,632 cases, Katsina with 767 cases, and 675 cases in Taraba states, all in Nigeria's northern region.
The northeast has been torn by all sorts of insecurity issues, and so it actually makes some public health sense if there is an outbreak from poor water and sanitation issues. Cholera is largely transmitted by fecal contamination of water and food sources, and it causes diarrhea and severe diarrhea cases and sometimes vomiting.
The NCDC says cholera killed over 2,300 people across the country last year. It's the country's worst outbreak since 2017, infecting over 60,000 people, mostly children. Experts want the government to engage in public hygiene campaigns and provide safe water for things to improve.
Addressing the root cause is always the place to start. So we're looking at, can we have some provision of proper water and sanitation services? Can we ensure environmental sanitation across the country? Can we provide a proper health education to people? People should know that they can sanitize their hands properly and they should take care of their food.
The government says it has adopted several measures to tackle the situation. It has activated national cholera emergency operation centers in several parts of the country. The centers are to support states to ensure a coordinated, rapid and effective response to the outbreak. It has also launched a plan to improve provision of clean water to citizens. Communities without access to drinking water like Junta are hoping something changes soon, reducing their vulnerability to cholera infections and deaths.